Well, chronic back pain can be debilitating. It can affect your work, your relationships, and even your mental health. Dr. Robert Odell joins us to tell us about a procedure that could be the answer for people who have been searching for relief. We're also joined by Nancy Gray, a patient who's been receiving the treatment we're going to talk about today. And Dr. Odell, this is a in-office procedure that's relatively simple and is somewhat new.
Yeah, radiofrequency has been around for a long, long time, and it really is relevant for people who have pain coming from the facet joints, which is back here. I'm using the lumbar region, but it works every area, most commonly down here. And what it is, it's a form of arthritis that people get. Same as a knee joint. You have bone, cartilage, and fluid. And as people get older, especially people who've been in car accidents, there's damage to the capsule, and the incidence of facet pain will go up as a person gets older. And in the old way we did it, we came in where the nerve is located. I don't know if you can see it right here, using a regular needle. And we came in right here where these nerves are and burned those nerves. You've got to be careful not to burn the big nerves, and that's built into the safety of the procedure. It's widely practiced. But with this new device, this is called Tri-Needle by Duros. I don't know if you can see, but there's 3 little tines that are come up.
Yeah, camera 3 there. Just hold it toward that one, and they'll be able to get a shot of that. Yeah.
You see that? Boy,
so you have some things protruding out of the end
Yes.
there.
What that does is, and when you look here, when you come down to where the nerve is located, the tiny little nerve that feeds the facet, that innervates it, you can put that little device right there, and you come in 2 dimensions. It's a 2-dimensional procedure, not 3-dimensional, which is way easier. And you get a 3 or 4 time larger lesion. Patients, first of all, more people get better. They get better for longer. It'll last anywhere from 6 months to 2 years instead of the usual, sometimes as low as 6 weeks to 3 months for the regular needle, which is just a 3mm burn.
Right.
The whole idea of radiofrequency is to make a very, very tiny burn so you limit the damage to other structures.
And it's working. I want to ask about who it would work for, but Nancy, you're one of the individuals who it's worked for. Tell us about how long you've been doing this and what it's done for you.
I've been doing this since 2014, and I get it done pretty much on a semi-annual basis. And I find that when I get the procedure, there's a couple days of, well, it feels like somebody's punched you in the back.
It's downtime.
Yeah, it's downtime.
Yeah.
But after that, I'm good to go.
Yeah.
And I can cut my opioids way back.
Oh, wow. Which is so important, right?
Yeah.
Because that affects so many things. So, Dr. Odell, then how does someone know that he or she might benefit from this procedure?
Well, I just want to add with Nancy is she also had some thoracic facet syndrome, which is thoracic pain. You know, the chest in the back is between, say, the lumbar area and the neck area is it's actually underserved. A lot of doctors miss it. The nerves here, just not to be too technical, but the nerves kind of float in between. These things are called transverse processes. The nerves float kind of float in between. And what we do with this device, because it's such a large burn area, we have a great success rate. I've not had one failure with the thoracic procedures, although the number is very small compared to the low back. People who have facet pain often have a pain that, first of all, it hurts when the doctor palpates right on the structure. Second of all, they can have pain going down the leg, which is, it's not radicular. It's not from the spinal nerve. We have a fantastic test that doesn't hurt in our clinic called A-delta NCS, which actually will determine whether it's coming from the facet or coming from the disc. It's from the larger nerves.
Well, and we're out of time now, but I want people to contact your office to find out if they are going to benefit from this. It sounds wonderful, and Nancy, thank you for being here. Neuropathy and Pain Centers of Las Vegas is located on West Sahara and 8084 West Sahara, and you can call that number on your screen to get more information, 702-257-7246, or go to their website, nvpainrelief.com.